Welcome to the Dr. Mudgil podcast. This is episode 169. We are kind of halfway through February already. I can't believe it. Time is flying. I know I say it all the time, but you know, when you get old like me, you repeat yourself. It's winter here in New York. You know, we had some snow, a little wintry mix action. I think there's more snow on the way. Tomorrow is Valentine's Day, so you'll be seeing this the day after Valentine's Day. I hope you all have a wonderful Valentine's Day. And I'm going to kind of hit on some of the similar themes that I've been talking about in the last podcast, just because there's been so much going on, you know, politically in the world. So this week, you know, everything is, well, last week and really for the last couple of weeks, there's been a lot of news about DOGE, the Department of Government Efficiency. And it's fascinating. I mean, I always knew that there was waste in government, like taxpayer dollars were being used foolishly. But the degree to which is actually insane. And it's interesting because it depends which media outlet you really watch and, like, you know, where you get your information from and how much information you're actually going to get. So, you know, if you watch, like, you know, sort of, you know, MSNBC or CNN or, you know, I guess one of the more liberal-minded news channels, most of the news is like just rage about, like, Elon Musk, unelected official, going through, having access to, you know, these various government agencies and combing through it. But more conservative news channels, like, say, like Fox News, for instance, there's actually like a ticker that they have sometimes during their news programs, which literally like shows you like all of this stuff that's been uncovered, like, you know, $40 million here, $100 million here, like, you know, for all kinds of literally objectively insane things. Like, it's crazy, like how many, like, millions, hundreds of millions, billions and billions of dollars, I'm sure, are just being wasted. Our taxpayer dollars are just going to these crazy initiatives, like, all around the world, where, like, you know, in the United States, we don't have universal health care. You know, folks aren't covered by, you know, for just routine health stuff. It really just blows my mind and it infuriates me. The interesting thing is it's also become, like, very bipartisan. So, like, you know, Republicans are, you know, like, all for it, you know, all for, like, the reduction in waste. But interestingly, there was actually a very interesting article in the New York Times where, you know, a lot of Republican senators and congressmen and congresswomen are all for it, except for when there's a cut that's made for something in their state, which is understandable. I mean, they're representing their constituents. And then, you know, the Democrats by and large are just, like, up in arms. You know, you just see, like, you know, protests and they're infuriated. But what I do think is something that, you know, we can all agree on. Like, you know, objectively, there's so much waste. There's so much money, our money, your money, my money, taxpayer money, that's being wasted. I mean, talking like billions of dollars, and they haven't even started really combing through, like, big ticket stuff. So that had me thinking. I mean, I just can't wait to see what happens when they start going through the Medicare Advantage plans that are run by just evil, vile companies like United Healthcare, Aetna, Cigna. They're all terrible. United Healthcare being top of the list, numero uno, horrible player. You know, there's just so much fraud taking place where these private health insurance companies are just ripping us private citizens off and stealing our taxpayer dollars to enrich themselves. And I'm going to present some very tangible examples. So there's an article from 2017 in the New York Times, which we will share with you. We'll share the link to you. But this is going back to 2017, so like literally 8 years ago. And the title of the article is United Health Overbilled Medicare by Billions, U.S. says in suit. The United States was suing United Healthcare. I'm just going to read you a blurb of it. I'm not going to read you the whole thing. The Justice Department has sued United Health Group, saying that senior executives knew the company was overbilling Medicare by hundreds of millions of dollars a year and halted a repayment plan in 2014 so the money could be used to meet Wall Street's revenue expectations. In a complaint filed Tuesday at United States District Court in Los Angeles, the Justice Department said United Health routinely combed through millions of patients' medical charts, searching for data it could use to make patients look sicker than they really were, in what the lawsuit called a strictly one-sided revenue-generating program, or scheme, I would call it. Under the government's popular old age health program, Medicare Advantage, Reporting unhealthier customers led to bigger payments from the federal government. $3 billion worth to United Healthcare from 2010 to 2015 alone, according to the complaint. The Justice Department said misrepresenting people's health was a civil fraud and sued for triple damages and other penalties. So that's one example, and you can read the article. It is literally will blow your mind. It's crazy how criminal these people are. And here's just something more recently, and this was like, it's hard to find tons of information out there, because a lot of the DOGE stuff isn't really public, but this is like something I found where they were talking about Medicare Advantage overpayments, and it says a 2024 analysis by the Center for American Progress estimated that Medicare Advantage plans were overpaid by 22 to 39%, amounting to between $83 billion and $127 billion in 2024 alone. I'm going to repeat that. So in 2024 alone, Medicare Advantage plans were overpaid, meaning they screwed me out of taxpayer dollars for between $83 billion with a B and $127 billion. That should infuriate you. I mean, that is crazy. These overpayments were primarily due to practices such as upcoding, where insurers documented more severe diagnoses that warranted and selection bias, enrolling healthier individuals while receiving payments adjusted for sicker populations. Now, I'm going to dig into this a little bit. So I think it must have been in like November or something like that. I posted a podcast about Medicare Part C. So Medicare Part C are Medicare Advantage plans. And we're going to put a link in the description of this video so you can go back and listen or watch that podcast, I should say, where basically I believe Medicare Part C, I believe that C stands for crap, because Medicare Part C, those are Medicare Advantage plans, precisely what that New York Times article is talking about, and what that little blurb I read you is talking about. Medicare Advantage plans are basically like a capitation system run by private health insurers like United Healthcare. And basically what they do is they get like X amount of dollars, from the federal government for patients that they enroll. So say they get, I think it was like, back when that article was written in 2017, I think it was something like $3,500 and change. Don't quote me on that, but it was something like that for each person that they enroll. The way health insurers make money is basically they get that money. So say they enroll like, 10 people. I mean, obviously, it's many more than this, millions of people. But for the 10 people they enroll, they get like, say it's $3,500 a person, they get $35,000. Now, again, these are grossly under exaggerated numbers, but just for the sake of the math. So United Healthcare is now sitting on $35,000. In actuality, it's like, billions and billions of dollars, I'm sure. But the only way they make money is by holding on to that $35,000, right? So the only way they do that is by denying patients benefits. So say you need a CT scan that costs like $5,000. United Healthcare, that's going to cut into that $35,000 they have sitting in that pot. They're not going to give it to you. They're going to deny until you give up. Doctors submit our charges to health insurance companies after we see the patient. So I see you, I treat you for whatever your problem is. You're off on your way. Then I submit those charges to United Healthcare. United Healthcare will generally, try to, sometimes they pay, many times they ask for you to send your note, and then they lose the note, then you have to resend your note. There's a whole big scheme, and then they'll say, oh, well, on the claim form, this I wasn't dotted and this T wasn't crossed. We're only going to pay you this much. So instead of paying you like a few $100, for the patient's visit, they'll say, okay, we'll pay you like $50. So that way they're holding on to as much of that 35 grand as possible. Sometimes they'll say, you know what? We're not going to pay you anything. That service wasn't covered, or the patient didn't have a referral for that visit, or whatever bullshit that they employ. So they basically get us to see patients for free or next to free. And honestly, free a lot of the time. They don't care. The patient's been taken care of. So, from their perspective, things are good. The patient was taken care of. But, they don't want to pay the doctor for the service that they already rendered to cure the patient. So it is a total racket. But even worse than that, United Healthcare owns Optum. Optum owns doctor's offices. So patients will go see their doctor at Optum, and the doctor usually there, it's at some like, private office where, really there's nothing purer than the doctor-patient relationship that I've said that many times. Patients come to their doctor because they're sick and want to get help. Doctors literally give up the entire decade of their 20s and into their 30s to, making less than minimum wage, much less than minimum wage, so that they can pursue their passion, which is seeing patients. There's nothing purer than that. Patients come to the doctor because they want to help. Doctors go to all the schooling because they want to help their patients. I mean, that's as simple as it is. What gets in the middle of that are companies like United Healthcare. They want to try to maximize their profits off the backs of patients and off the backs of the doctors that care for them. So going back to what I was saying, United Healthcare owns Optum. Optum owns doctors' offices. One of the many things that they do. They also control pharmacies and a whole bunch of other stuff. But what they'll do is, the Optum doctor will see the patient, and instead of it being like a private office where, there's a very, the doctors have a lot of autonomy and can really care for their patients, it's like an insurance mill. And the doctors are, generally like salaried employees of Optum. And they'll see their patient, they'll do whatever their coding is, and then that goes to some shady back office where someone is like, looking through the codes and changing the codes and, looking through the patient's chart and trying to add other codes and like, identify other diagnoses that will basically defraud our government, us. Our government means me and you, by upcoding the visit. So like, say someone came in for like a routine visit, they'll add all this other shit in the back office and then submit that to Medicare so that they get paid more money from Medicare using our taxpayer dollars. But guess what? The patient doesn't benefit from that at all because the patient's already been seen by the doctor and the care was rendered. And the doctor doesn't benefit from that at all because the doctor's getting some payment already from Optum Healthcare. Who benefits from that? Optum. And then who ultimately benefits? United Healthcare. It's a crazy racket. So I am just waiting with bated breath for DOGE to take a look, because this might be the impetus for the change that we have been asking for so long. There's nothing shadier in this world than private health insurance companies. Companies like United Healthcare, Aetna, Cigna. They don't care about you as a patient. In fact, when you get sick, when you're paying a premium and you're healthy, they love you. You're paying into that pot. You're paying into that pot, but you're not withdrawing anything from the pot. So you are a cash cow for them. But the second you get sick and you start withdrawing money from that pot that United Healthcare is sitting on, that we're all paying into, they literally want you to die as fast as possible. That is an absolute fact, because you know what? You're costing them money and you're not making them money, and all they care about is making money off your back as a patient and my back as your doctor. So with that, I hope you all have a wonderful, restful weekend. I hope you had a great Valentine's Day. Remember, it's up to us, patients and doctors, to be as vocal about these issues as possible. That's the only way we're going to enact change. It's unfortunate that our elected officials are basically on the payroll of these private health insurance companies through like political action committees and all the other crap that goes on behind the scenes. But sometimes it takes an outside of the box thinker, someone like Elon Musk, who's running DOGE, to take a deep dive into these issues objectively and say, hey, wow, this is insane, the amount of our taxpayer dollars that really should be allocated to taking care of us, the citizens of the United States, how much fraud and just crazy, frivolous spending there is that's hurting each and every one of us. So with that, let's get it.